media told you that we need to get, what they did was this. They redefined what being vaccinated was. They told you that for that 14, 15-day period post-shot, you were still unvaccinated. And that was the key. Why did they do you that? So that the public health officials in Canada could come to you and the media and deceive the public and tell you that this was a pandemic of the unvaccinated. That was a falsehood, a gross falsehood. They were taking the vaccinated people who were becoming infected and hospitalized, and they were placing their events in the unvaccinated bucket just by a simple change in the definition. That is why somebody like me came today, so that I make sure that I share some information you didn't have. So when the media told you that we need to get...
And that's how they actually define it. It's written right here in definitions. But we already know that Public Health Agency of Canada was using algorithmic bias to skew the data in the favor of vaccines. So it would not be extremely difficult to guess that they were doing some other techniques to improve the appearance in the favor of vaccines. So I do not know how the definitions were used or reused or defined, but this is the open question which I would like to put forward for open debate with Paul Alexander. It's very unfortunate that he doesn't have an opportunity to discuss these issues with the official representatives from the government, and I am not representing the government. So again, what I'm trying to do here is that the truth could only be discovered through the discussion, through the questions and answers. Someone will need to make a statement and someone else need to challenge it. So there is opportunity to prove that the statement is correct, or maybe to prove that it was not correct. So a number of very, very, I would say, harsh statements were made by Paul Alexander. And you can look at his wiki page. He has a lot of credits and experience in this field. I do not have any experience in the field of epidemiology, but I just have experience with data manipulation. I have experience with the government. I know a lot how government works and how data could be used or manipulated in such a way that as to support one point or the other. So here, in the absence of any debate between Paul Alexander and any official representatives from the government of Canada, I'm offering Paul Alexander my personal opinion, not as a representative of the government, but just as a data scientist working on my own at lunchtime, on weekends, looking into the data myself and trying really to match the data the way they are published on official portals with the statements which were made by Paul Alexander. If we can show one way or the other that what he has said about the definition of fully vaccinated, that this is exactly the case, then of course he has even more weight to what he has been presenting. And of course he is not the only one. There are many other very prominent scientists in this field who are talking about the way data has been manipulated to favor a particular narrative of vaccine manufacturers and governments. But I'm making it difficult. I'm making it difficult for them to prove that they're right. I allow them opportunity to prove to everyone that what they're saying is indeed the true situation. I looked at the definitions and I showed you on the website how the definitions of fully vaccinated are defined, how the deaths and cases are defined following vaccination. So it's very difficult, actually. It's very difficult to match exactly the definition of fully vaccinated with the number of doses received. We don't have all this information when people died before 14 days or after 14 days after receiving the vaccination. But again, we do need to have this open discussion, and I appreciate so much his efforts and efforts of everyone who's going forward and seeking for the opportunity to discuss, to debate these issues. The very fact that government officials are not offering an opportunity to debate such statements, I think it's another missed opportunity for the government as well, because the government can show that actually these definitions are very well defined on the website. So it could be a fair discussion, a fair debate, which will most importantly bring together the two divided populations in the country, which will show that again possibly the data could support both camps. Another statement which was made by Paul Alexander, that vaccine never worked, but you remember we looked at the data on the efficacy on the website, and it is the plot which shows the odds, right? And you see that the red bar, which is the odds of dying having 0 doses versus 2 doses, you see it's 13.12 in July, right? So it's actually it's over 10 times more. So the odds of dying with COVID were more than 10 times more for people with 0 doses compared to 2 doses at that time. And then of course we see that the difference becomes less and less, and now it's actually 1.58. So that's and again, how we computed, it's averaged over 3 weeks here. So this is why these are the numbers do not match exactly the numbers in this graph here. But most importantly, we see that the odds change over time. So to be more correct from a data perspective, I think it would be better to say that vaccines were helping more in the beginning than now, and we see that the efficacy fades with time. And when the 3rd dose was added, it also faded, its efficacy faded over there. You would see in those graphs, like the last small bars in here. So that's the point which I wanted to make. I would like to provide opportunity for a debate, for not to be afraid of asking tough questions. And you see, I'm asking 2 very difficult questions, I would say. If Paul Alexander can show that this graph does not support the vaccines, good for him. But from this graph, at least using the methodology which is used by PHAC, it shows that vaccine was helping, but less as time was passing. Now, there is more data here. If you click on this link, there are more graphs here on vaccine efficacy and data, not only for deaths, but also for hospitalizations and cases. And you would see this red bar, sometimes it could go up, meaning 0 doses would die more frequently than the average. But now you would see red bar is very much less than the average. So this is indication that 0 doses since May have less chance, less frequency of being hospitalized, or actually this is of cases, sorry. So this is less chances of being infected, less chances of being hospitalized, and less chances of dying. So in the last 4 weeks. So again, we need to compare this portion of the graph to this portion of the graph. And we see it's, of course, it's very different. Look, compare red bars here and red bars here. Here they're over the blue line. Here they're less than blue line. So it shows that the efficacy changes over time. So 2 points for the discussion, which I'm providing opportunity for Paul, Alexander, and anyone else, essentially to prove their points. Okay? So 2 points about the definition of fully vaccinated and the fact that vaccine were doing something to reduce the odds of dying in the beginning, and maybe now not as much. So and what I think we could do just to keep this discussion, people need to talk about it. If there are questions and no one asks those questions, then instead of resolving the problem, we just create additional mistrust and dislikeness of each other. And I work with many people who support vaccines, who have done vaccination, and myself also looking at the data which was available to me a year ago. I was one of the first to receive a vaccine, my first dose. But again, the data changes, and now it's different. So it's very important to remain objective. I know it's very difficult to remain objective when we're already so passionate about our beliefs. But now it becomes not a science anymore. It becomes a religion. If people just believe what they want to believe, what they used to believe. And this is why I'm really trying to close now this discussion. I will be having less these presentations. I need to focus on my other job, but really I'm trying to bring this message that let's try to keep the data visualization as objective as possible. Thank you everyone for supporting us. I hope I will see some of you next Friday as we will be marching with James Top. Have a good weekend.